Okay, and then we're gonna go from current slide. You know what? Let me just go from the beginning real quick. Oh, okay, share. And this is gonna be screen three. All right, just to do a quick recap of the Emmy Power 101. Obviously, every moment is either priceless or wealth or worthless. Medicare again, U.S. citizens, nationals, or people lawfully present in the U.S., 65 or older, or people under 65 with 24 months or more. On disability, people with end-stage renal disease automatically qualify for Medicare. We can enroll first 3 months before the month of the birth, the month of birth, and 3 months after. When can you enroll? These are the election periods. The one election period that is not on there, okay, is the ICEP2, which is when you have disability, when you're under 65 and you qualify for Medicare. When you're under 65 and you qualify for Medicare, that gives you an initial enrollment period. But when you turn 65, it gives you an additional initial coverage election period, number two. And that one's not there, but that one does exist. Okay. A, B, C, D, right? Part A, original Medicare. It's very, very important to get the original Medicare thing in your brain because that's how Medicare started. And then Part C came along. So original Medicare, Part A, Part B. Again, Part A, hospital. I tell people, people don't understand it. All it is a building called a hospital. That's what the insurance is for. Part B is medical, everything they do to and for you. And then when you leave the hospital, you need to be able to get your prescriptions. So you have to have your Part B within 63 days of being qualified for Part B. So A, B, and D are original Medicare. Part C is called Medicare Advantage. And I tell people to understand that Medicare Advantage, let me tell you what it is. Original Medicare pays 80/20. They pay 80%, you pay 20%. There are two ways to cover the 20% gap. Part C, Medicare Advantage or Medicare Supplement. Okay. Let me tell you the difference between Medicare Supplement and Medicare Advantage. First of all, it's pretty simple. Medicare Supplement, also known as Medigap, are private financial companies, and it's a cash for cash transaction. Okay. These, you pay them cash every month in premium. They pay the doctor bills and the ambulance and surgery bills when they come due. So you pay them cash, and when it's time for doctors to get paid, they come and pay cash on your behalf. Now, these plans do not come with a prescription drug plan, so you need to purchase one separately. Now, Medigap plans, Medicare supplement plans, also have letters from A through N. Most popular plans are Plan G and Plan N. Okay. Every plan has the exact same benefits no matter where you buy them. If you buy a Medigap Plan C in Alaska, Plan C in Florida covers the same way. The only difference between supplement plans are the price you're going to pay in premium based on where you live. That and that alone is a Medicare supplement plan. It is not health insurance. It is a financial policy, an insurance policy um, against that 20% gap that Medicare doesn't cover. Now, that's it. Now, Medicare Advantage is called Advantage because these plans come with many advantages that don't come with original Medicare, like dental, vision, hearing, gym, transportation, over the counter benefits, just to name a few. But the biggest advantage is the maximum out of pocket. Okay, Medicare does not have a maximum out of pocket. So maximum out of pocket is what you pay in deductibles, co-pays, and co-insurance. Okay, for example, if a doctor has a $20 copay, okay, and he charges 100, that would be the copay. If he has a 20% co-insurance, same doctor that charges 100 will cost 20%. If he charges 200, it will be a $40 co-insurance payment. Now, what you need to know is once the maximum amount of pocket is reached, the insurance company pays 100% of your covered medical expenses for the rest of the year. Now, Medicare, uh, original Medicare, like I said, has no yearly out of pocket. So, bottom line, if you have $1 million medical bill, you have a 20% co-insurance, that's a $200,000 co-insurance bill that you'll have, and there is no limit. Now, if you have for the same $1 million in medical bills with a Medicare Advantage plan like this one, you would only be on the hook for 4,500 bucks, 200,000 or 4,500. Which would you rather have to pay? We're at the halfway point. Okay, let's take a quick moment here. I tell people, I know this is a lot to process. Don't try to remember it all. You don't have to. There's only one thing that you need to know about Medicare and you need to remember is that we know Medicare. Okay. And then we take a break and we come back. Okay. Okay, here we go. And I do the piece of paper thing. I absolutely do the piece of paper thing. I take out a piece of paper. I said, listen, what's going to happen is that by the time you have dinner tonight, and this has been a study, all right. And I also saw somebody do this on TED Talk as well. This is long known that human beings forget 75% of what they hear within 3 days. So I tell people, I take out a piece of paper and when I'm at that event, and I'll just say, this is what you know so far. By dinner time, I fold it in half. You'll remember this much. By the time you go to bed, you'll remember this much. By the time you get up tomorrow, get up, shower, have breakfast, go to work. You're remembering less and less every day, which is why it's a good point to make that the best time to make a decision is when the facts are fresh in your mind. That's a rebuttal that I've been using for 30 years. The best time to make a decision is when the facts are fresh in your mind. If somebody says, I want to think about it, let me tell you what's going to happen when you think about it. For most people, and I'm talking about most human beings, myself included, we forget 75%. And that's how go into that. That's answering an objection before it takes place. Okay. Now we go. So I tell people if you go to Google and you type in Medicare parts, you get 76 million results in less than a second. And you're going to see things like this, and my personal favorite, this one. Okay. So does any of this look simple? And most people are shaking their heads. For the average person, it's not. And let me give you a news flash. As a professional Medicare health insurance agent, it's not simple for me either. Far from it. The federal government puts us in charge of helping seniors, people that are on disability for 24 months or more, and often at the most vulnerable times in their lives. And burdened with that responsibility of taking care of these people's agents must know what they are doing. And they are required by law, at the minimum, to pass the state accident and health insurance exam, the AHIP exam. By the way, if you get a trying to sell you Medicare, one of the things that we tell our clients is ask them what's your insurance license number. You'll be surprised at how many people will hang up. All right, so we have to do the yearly AHIP exam. We also have to do yearly carrier recertifications. We have mandatory continuing education, all that training because the consequences of getting it wrong in the health insurance industry, the consequences are simple. On the healthcare side, getting it wrong causes stress, anxiety, and concern. And we all know the effects that those things have on a person's health. Beneficiaries, okay, and or agents that get the wrong plan, beneficiaries end up losing their doctors, which brings us to the second most important aspect of a beneficiary's retirement on the financial side. That means that they have to either A, pay out of pocket to continue to see that doctor, or if it's too expensive, they have to find a new one. Okay. Let's pay out of pocket. If not, they have to find a new one. And if you know anything about looking and finding a good doctor is like finding a good mechanic. You have to, shop around until you find one that works. All right. And that's something that we help people do, something that nobody else offers beneficiaries is we get on the phone and we make sure that the doctor is accepting new patients and that they accept the insurance. Incidentally, one of the reasons, okay, if they get it wrong, they end up with unexpected medical bills. Okay. They also can't get their medication. If their medication is not on the formulary now, they have to either pay out of pocket or go without if it's too expensive. Okay. And this happens to a lot of people too. From one day to another, they've lost their coverage entirely. And that for most people could be absolutely catastrophic. So consider these two things, okay, when you make your choice for choosing your Medicare plan. Number one, now you understand what it takes to understand Medicare. Number two, the consequences of getting it wrong. Okay, now three options the beneficiaries have, only three. They have number one, they can pick the plan themselves. And based on our experience, most people that go that route usually end up more confused than when they started. Okay, option number two. Okay, I'm sorry. Let me go back. Uh, People who end up doing it themselves usually end up more confused than when they started. And uh, t- 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 okay, let me step that over. It's been a while since I did this 101. You have three options to get your Medicare health insurance covered. Number one, do it yourself. You have the Medicare and you book. You could take it home. You could learn it. It'd be a good thing for you to learn the basics. But as you know, it's just not that simple. As a matter of fact, the Centers of Medicare and Medicaid services released the changes coming to Medicare for 2024, and it came out in a 300-page document. For 2025, it was a 401-page document. Option number two. Okay, you can get your coverage the way most people do: internet, radio, television, brochures, and postcards, letters they get in the mail, ads on Facebook, Google, YouTube, and robocallers, which are getting more and more sophisticated with AI every single day. In January of 24 alone, there were 31 million robocallers made to beneficiaries inside the US. And all of these ads and all of these phone calls, they usually end up at a call center, talking to a call center agent. 95% of all insurance is sold by a call center. And I know this because I was one of them. Now, in 2020, did I have this? Okay. This is part of the presentation. In 2020, I started in Medicare. I started at a company that had almost 20,000 agents. I was one of the top performing agents. Now, for you guys doing this, you could say it this way. You say, all right. In 2020, the founder started looking into Medicare. He worked for a company with 20,000 agents. He was one of the top performing agents. He trained 300 agents. 9 months later, he became an instructor. 3 months later, he became a supervisor and a team leader. And 2 months later, he went back to being an agent because he saw what was going on. 7 months later, in July of 2022, he resigned and he started ME Power Insurance. So that brings us to our last option. First option, do it yourself. Second option, do it the way 95% of people do it. And the third option is ME Power Insurance. ME Power Insurance, we are an independent insurance brokers. And what that means is that nobody tells us what we can and cannot sell or what we can or cannot do for beneficiaries. We are a new breed of caring professionals, not a bunch of empty suits. Our goal is to make a transactional process into a transformational experience. And like I said, once you guys have the slides. Once you guys get these words down, you'll be able to just spit them out without a problem. All right. We are licensed and insured. Every phone call is recorded and records are kept for 10 years, which is above and beyond what Medicare requires us to do. We are a haven for people. We are legitimate, professional, and reliable resource for Medicare and health insurance information throughout the year and for life. So let me tell you how it works here at MEPOW. Okay. First of all, the longest conversation that we have with a beneficiary is the first one. We evaluate the person's covered coverage, and if they're good and they don't need to make a change, we tell them. But if they're not good, we help them fix it. Okay. It's optional, but it's highly recommended. We also do a health risk assessment when we enroll somebody into a plan because our whole point is about keeping people healthy rather than just helping them get better once they get sick. So whether a person enrolls or doesn't enroll with us, okay, we follow up. We call a person twice a year. Okay. First of all, we call them within the first 2 weeks of October. That's when we get the new plans for the following year. Then we're going to call them once again in February or March because that's during the open enrollment period that Medicare gives us to make sure that the plans are working as planned. Following that, most of our clients forget about Medicare entirely. Okay, we do make checking calls throughout the year, every few months to make sure that people are okay. But other than that, twice a year. And from that point on, the ads, the phone calls, the letters and postcards, all the brochures, all the insane shopping, you can put that behind you once and for all because there is no more shopping to do. Okay. We find you the plan that has the most coverage for the least amount of cost and risk. And sorry. So except for any letters that people get from Social Security or Medicaid, if people get letters in the mail that they don't understand, the first thing that they do is they call us and we make sure that that letter is legit and any issues that come up, we help them handle it throughout the year. Okay. That is what we are here for. That's Emmy Power Insurance, where every moment is either priceless or worthless. And that's it. If Emmy Power sounds like a place for you, you can set an appointment with one of us today when we're at the Medicare 101s. A lot of people will set appointments on the spot. And again, I know that we just breezed through this. I wanted to get through it quickly because we had to finish it the other day. But does anybody have any questions about that 101? Now, how is your level of understanding after it since you've seen it a couple of times? Susan?
Um, a, just a question. Where do we keep the records at? Like if we do the Zoom, let's say we're meeting with some, you know what I mean? Because a lot of people ask, where do you keep that at? Or uh, like when I keep the other recordings and stuff, do we keep it or does it go somewhere else?
The phone calls we record when we're on the phone. Okay, when
Hmm.
we're on the phone, we record. On Zoom, I just keep them in a file, because
Okay.
I don't really do a lot of Zoom enrollments, but I know you will be, being
Hmm.
on the phone. So we keep those Zoom enrollments. Now, as far as the phone is concerned, the phone is automatically recorded, and I pay for storage to keep those recordings.
Okay. Okay.
So every phone, when you have the Intels, let me stop sharing here. Let me share this. Come on. This right here, this is our phone. Can you see that? Yeah, right.
Hmm.
This is our phone recording software. This is our phone. This is our phone, period. Everything is in here, texting, chats, voicemail.
Oh, okay.
And then we have reports. Reports come down to call recordings. And all these recordings, this is just for today. All these recordings are um kept on a database for up to 10 years. Every call that's
Okay.
coming in or out. All right. Now, on your cell phone, all right, there's an Intel's app. And anytime you get a phone call to the MA pound number, it automatically directs it to Intel's so that way, even on your cell phone, if you pick up the Intel's phone, it's still going to be recorded and it's going to be stored for the next 10 years on the
Okay.
Intel's database. All right. Like I
Okay.
said, I pay every month to have that storage. All right.
Hmm. The only, otherwise, I think the more I hear it, I just have to start practicing it. So I printed it. Can't see it in that.
Nice, nice, nice.
So that
Nice.
I can start, even if it's just a page or two at a time and just start getting that to go. Um, that's what I need to start practicing.
How do you understand Medicare, though? A little bit better?
Oh yeah. Yeah, I was
Yeah.
trying to talk. It was funny. I was trying to talk to somebody about it the other day. So this is what I'm learning. And then I just messed it all up. So it's funny.
Ah,
But that's one step.
it takes a minute. Like when I
Yes.
started in insurance, I started not knowing. I didn't know what Medicare was. I didn't know when I
Hmm.
started.
Yeah.
and I got hired the for AEP. I got hired. Wasn't able to sell until 5 weeks left of AEP.
Yeah.
All right. So this was, and when I got on the phone, I learned it. I learned it. I made some mistakes like anybody else would,
Oh
but
yeah.
you learn. You learn it.
Yep.
Rick,
Exactly.
how much do you understand? How do you feel about the one-on-one? Do you understand it?
Yeah,
Let me stop
yeah,
right
I
away.
do understand. The more I see it, the more I'm understanding.